today's show, the Credit Valley Hospital and Trillium Health Center are partnering for patients by proposing a voluntary merger to improve patient care. Erin Mills Development Corporation donates $6 million to the Regional Women's and Children's Health Center at CVH. We'll get a tour of the new birthing suites and Regional Neonatal Intensive Care Unit. An update on MAM, the Mississauga Academy of Medicine located at UTM, Credit Valley, and Trillium Health Center. Code Pink training for frontline doctors and nursing staff. And highlights from the Credit Valley Hospital Foundation's Celebration Gala. Hi, I'm Dan McGann. The Credit Valley Hospital and the Trillium Health Center are proposing a voluntary merger to improve patient care. The vision is to create a new hospital, a world-class community, and academic health network.
I believe many of you by now will have had an opportunity to read an all-staff announcement.
An announcement was made simultaneously at both hospitals to doctors, nurses, and staff. A joint press conference was held April 7th to make the announcement.
Good afternoon. I'm Joanne Rogers, Chair of the Board of Directors of the Credit Valley Hospital. I'd like to welcome you here this afternoon for what is an historic announcement for the Credit Valley Hospital and Trillium Health Center. On behalf of the two boards, I'm pleased to announce today our intent to merge the two hospitals, subject to the outcomes of due diligence, which will include extensive community consultation, to create a new single entity that will become a world-class community academic health network. The new organization will focus on providing the highest quality patient care services to the communities of Mississauga and West Toronto. This morning, the board submitted a voluntary integration proposal to the Mississauga Halton Lynn. This is a natural extension of the close partnership that has developed over the last 3 years between Credit Valley and Trillium. We believe the proposed organization that will be created by this integration will provide the necessary patient care services so that residents of our community can receive the health care they need closer to home. I'd like to call on Sado, Chair of the Board at Trillium.
Thanks, Joanne. The vision for the new organization is to provide the best possible patient care in a community-based teaching center. It will also have increased capacity for applied clinical research focused on keeping 1 million residents of Mississauga and West Toronto safe and well. The proposed organization will develop better approaches to the provision of hospital care through teamwork among health professionals, physicians, nurses, and all other allied health professions. It will build a network of community health care providers that enhances the patient experience through coordinated access to 3 campuses: Trillium, Mississauga, Trillium, West Toronto, and Credit Valley, and a smooth transition from home to hospital and back. While the LHIN reviews the voluntary integration proposal, the boards will conduct a broad-based consultation to actively engage the community, staff, physicians, volunteers, and all our key partners in a dialogue. We will also be doing due diligence. When that process is complete, the two boards will make a decision on whether to go ahead with transitional planning. Thank you.
This is a unique opportunity for two organizations to come together and design their own future.
Both have rich histories in serving the community of Mississauga, and both organizations put patients right at the center of everything they do.
This is a great opportunity to create an organization that's totally focused on partnering together for patients.
We use all of those resources to make sure that the patient experience is not only one that is of quality and safety, but is also an experience in some of their most vulnerable times where they don't have to navigate the system. The system actually supports their care needs in a way that is much more seamless.
The public said, while you've got 2 emergency departments and you have an urgent care center, will they still be there for me? The answer is yes, they're still going to be there. Are we going to have our cardiac programs? Yes. The wonderful cancer programs at Credit Valley. By bringing people together and bringing organizations together, you actually have an opportunity to create more.
But there's also opportunities for our staff personally as you look at their development, their training, our new medical school and what that will bring to the new organization in terms of learning and development. And I think as we look forward, one of the real benefits of bringing the two organizations together is in fact being able to plan for the future to continue that legacy of outstanding attraction of qualified medical practitioners, healthcare professionals in general, by having a medical platform of over 1 million patients every year, where we are able to really provide an environment for the best to do the best.
For me, overall, I think it's an unprecedented opportunity to be able to shape the future environment in which we work and practice and take care of our patients in.
I think it's a golden opportunity. It's a wonderful endeavor. It's exciting, it's innovative, it's moving us forward.
I think that ability to unleash creativity, not only the organization as a whole, but also within the medical staff, once again, an unprecedented opportunity.
So some of the things that we do on a day-to-day basis will not change in either institution. There may be changes in the way we carry them out. If you need to go to the emergency department, it will be open. But once you're there, you know that you will get the same quality of care whether you're in one institution or the other institution, because you're now going to be in the new institution.
Certainly, the medical academy was coming. Both Credit Valley and Trillium were full participants in the teaching aspect of the UTM Medical Academy. Now, I think we'll be able to provide a more seamless experience for our students. The large amount of clinical work that comes here is going to allow students to be exposed to a huge amount of different cases and learning.
Patient really knowing that no matter where they come to, what door they enter, they will get efficient, quick, evidence-based, carefully selected, highly skilled care.